just talk one more time? Nope.
Is it working now?
It's working now. Sometimes it's as simple as just flipping the switch.
Some have called me a genius.
All morning long, I called the people who know how to do this kind of stuff, put all the shit together, and their answer was just unplug it and plug it back in, unplug it and plug it back in, and that's what worked. So anyway, I'm here. Hi guys, I'm here with Jordan.
Hello.
Jordan, and I'm not going to even
Arbelaez.
So I'm assuming that's
My husband's Colombian.
okay.
I stole it.
Just a little bit further down, like here. Perfect. Like there. Perfect. So you can do the rolling R's.
Yes, I can.
I can't do the rolling R's.
Like perro, perrito.
Yep. No.
Dog, little dog.
Wouldn't even try it. So we are here at the Center for Perinatal and Mood and Anxiety Disorders. I got that right. Yeah. What do you do here, Jordan?
I am a DNP PMHNP, Doctor of Nursing Practice.
LMNOP.
Yeah, alphabet soup. I'm a Doctor of Nursing Practice in psychiatry.
Okay.
So I'm a nurse practitioner.
Okay.
I went to Columbia to receive my doctorate in nursing practice, and so I see patients here, and I do medication management, diagnosis. I also do therapy. I'm certified in EMDR therapy as well as clinical hypnosis.
What is it? Oh,
so there's a lot
shit.
there. There's a lot of letters.
All I heard was hypnosis, and you can look at the camera if you ever wanted to do that. All I heard was hypnosis, and I'm like, I don't. First, let's talk about EMDR.
Okay.
What is that?
Okay, it stands for eye movement and desensitization and reprocessing therapy. So it's a trauma therapy. It was discovered in the 80s. I say discovered because I like to think of it that way, by this woman named Francine Shapiro, who has a PhD in psychology. And she was walking along one day in the park, and she was looking from side to side on the sidewalk as she was walking like this. And she was thinking of something distressing, and she noticed she felt more relaxed after she was moving her eyes like that. And luckily for us, she had a PhD in psychology.
How was she moving her eyes? Like just like
back and forth laterally.
Back and forth laterally. Yes. Okay.
Uh-huh. And so that's where the eye movement of EMDR comes from, but I'll explain more about that.
Shit, I feel like I invent shit every day. No, I'm kidding. So she's walking down the street, and she felt less stressed by doing that?
Yes, she was thinking of a particularly distressing event, is how she put it in her words. And she noticed that she felt more relaxed. So she was curious because she has a PhD in psychology. So she started to research this on combat veterans. She started just doing these eye movements using her fingers. They would follow her fingers and do those lateral eye movements as they recalled their combat trauma. And she found that long term, over 90% of these combat veterans had resolved their PTSD symptoms. So there's been a lot of studies done since the 80s, really good quality studies on the eye movements, and it's since been developed into a pretty complex psychotherapy that treats trauma.
So is this something that you practice with your patients, and then they use it at home and when they're feeling anxious or something like that?
No, that's not how it looks in practice. However, you are touching on something interesting, which is that bilateral movement or bilateral stimulation, which can be using eye movements. It could also be auditory. You can use that for relaxation purposes. But in EMDR therapy, it's just used in the therapy session, and then the patient goes about their life.
And that's just something you have them go through exercises and things like that?
Yes. So there's a few phases to EMDR. It's a pretty complex psychotherapy. It sounds a little simple when I just describe it as eye movements, but there's actually, like, when you're first learning, there's scripts that you learn, for example, to bring people through, to identify, for example, a core belief that's paired with a traumatic event. So that's something you're targeting in EMDR, is this core negative belief that the person has taken with them from this event. That's usually one of the reasons that trauma ends up being so devastating to people's lives, because there may be some belief paired with it, such as it was my fault, or there's something wrong with me.
I must have done something wrong for this to happen to me.
Right. And it can be different for different people. It may be completely different core belief, but that's part of EMDR is exploring what might be the core belief for this person.
And is this something that there's a beginning and an end, or is this something that your clients just continue throughout their life? And how is it different from other therapy?
It's a great question, because you're touching on, again, some more of the mechanics of EMDR that are more specific that I haven't explained yet. And in terms of length of therapy, it depends on these scales that we use in EMDR that were also developed by Francine Shapiro. And the scales include a distress scale. So how distressing is this memory to you when you recall it? 0 to 10. 0 is neutral, 10 is the most distressing. A lot of times people come to me, it'll be, 7 to 10 out of 10, usually. And then by the end or conclusion of therapy, we want it to be a 0.
Okay.
And so that will signal the end of therapy. And that can be anywhere from 2 sessions, incredibly, for some people who have a pretty specific trauma, to 15 to 20 for more complex trauma like childhood abuse, something that's a long-term chronic trauma.
Wow.
And you asked me another question in that.
I know. I don't remember what it was. I was so interested in what you were just saying.
Oh, there's another piece of the scale. There are 2 scales. I explained the distress scale. The other is the validity scale, and that is referring to that core belief we talked about. So once we identify a core negative belief, we want to come up with something that the patient would like to believe instead when they bring up that memory. What would you like to believe about yourself now? And they don't have to believe it yet, but we identify it together. So for example, if their core negative belief was, I did something wrong, then our goal belief would be, I did the best I could.
Okay.
And so then we'll scale it at the beginning, 1 to 7. How true does it sound to you? You did the best you could given in this situation, this trauma. And a lot of times it'll be 1, completely false. And so by the end of therapy, we want their distress level to be 0 or neutral. And we want their validity of their positive belief to be 7, completely true. So they feel no distress when they think of the memory, and they feel very strongly that they believe in the positive belief about themselves in this setting.
And you mentioned hypnosis. Is that paired? Are those done together?
They're not done together traditionally. I became interested in hypnosis through doing EMDR and kind of watching people reprocess on their own and noticing how much of the unconscious mind was involved in that processing. That might sound kind of hard to understand, so let me see if I can explain it to you. Like, for example, when we're doing an EMDR session, we'll identify the core negative belief, right? And we'll bring the traumatic memory to mind, and then we'll start doing eye movements. And the patient's not speaking at that moment; they're just thinking. And then I'll stop them like every 45 seconds and say, "What's coming up for you?" And they'll just give me a couple sentences, and they'll say, "I'm thinking about how I'm so ashamed of myself for doing that." And I'll interrupt them sometimes so that we can stay on that part of the memory. We'll keep doing the eye movements, stop them. And I'll start to hear them slowly becoming a little more positive, and as they process it, right?
So just saying it. So as they talk about, I'm ashamed that I did this, or I was involved in this, or whatever it is, just saying that out loud, that takes away some of the power? Or it just makes it more, it makes them aware that I don't know what. I don't know.
You're touching on what processing, the essence of processing is. Yeah. So it's, when you have a very traumatic memory, you don't just sit around and think about it like you think about, why is the sky blue? Or I'd love to go on this vacation in the future, and then think about all the details and think about what you'd like to do. You don't do that with traumatic memories because it's too overwhelming. It's too stressful, right? It lights up the amygdala, which is the fear-based part of the brain. There's no cognitive reasoning when your amygdala is firing because you're in survival mode. So you're just not processing. That's where that processing comes in. in a very detailed way. So yes, what you're saying when you're thinking about it, thinking through it, is a unique approach to this memory that you haven't given it before. You haven't been able to. And so the therapist enables you to do that by being there with you and holding you in that space, keeping you present with the eye movements, right? Mm-hmm. That's part of the reason we do the eye movements, is to tax the working memory. So it forces you to be here so you don't get lost in that scary memory.
Oh, okay. All right. And that sounds terrifying in a certain way. I mean, because I guess all of us have different levels. We're human beings. Being a human being is not easy, and you go through a lot of shit. And I think when you're younger, and I don't want to get deep into your area, but when you're younger, you're kind of living life. And if you have a nice, Lisa just mentioned before when we were talking, we had like Disneyland childhood. We had wonderful childhood. I mean, it wasn't perfect. We were in the feral children generation where you leave and go figure it out yourself. But there's a part of me that thinks that was good. I learned how to deal with difficult situations at a very young age, and therefore it was much easier as I got older to handle them and to make decisions, to whatever decisions they were. But again, we're humans. So whatever, and even the word trauma, I get a little mixed up with, because what one person considers trauma, another person consider, like me, well, this is just being a human, and just fucking get through it and suck it up, and that's how it goes. Mm-hmm. And I'm sure you'll say to me that both are valid, right?
Yep, you know where I was going with that.
Yeah. I know, they are.
It's subjective. Trauma is subjective at the end of the day. So somebody could come to me and, when I do an evaluation, not everyone I see is going to do EMDR. So some people may come to me and say, I had this, I don't know about trigger warnings on this, but trigger warning here. Like, someone may come to me and say, I was sexually abused as a child. And my first response might be like, oh, they probably need EMDR. But now that I have more experience, I've learned that that's not true. Some people have had what's called post-traumatic growth on their own.
Okay.
And so not everybody is traumatized their whole life because they experience something traumatic, even if subjectively it is traumatic. Do you know what I'm saying? So,
well, sure. Because, I mean, I don't want to get into nature, nurture. I mean, I would talk about that all day long. But
both are true.
Right. All can be true. Mm-hmm. It's not an either or, black or white situation. It never is. Things can exist at the same time. But some people kind of handle things in a very suck it up kind of way. Mm-hmm. And that works for them. Mm-hmm. It's not meaning they're hiding things, or it just is how it, right? I mean, it works for them. My father was a college coach, and he was a tough guy. He was a wonderful, wonderful man, but he was a college coach, and he was a suck it up kind of guy, and I'm a suck it up kind of girl. I'm like, hey, okay, let's move on. My siblings are not. Same family, same parents, same, similar experiences. Obviously, well, again, Disneyland childhood, they have a completely different approach to that. And one of them isn't unhappy with that's how he was parented. And I'm like, why? You know what I mean? But I guess we're such different human beings. It's so individualized.
It is. It really is. And you said a few things that I wanted to respond to. I think you're getting into an area that's very interesting. It's like the ethical dilemma of mental health. And I remember being an undergrad in psychology and having this question pop up for the first time, being like, well, how can we say somebody is mentally ill? Like, right. What does that mean? Like, how do we define that? Because it seems very subjective, and it seems like you could almost start oppressing people by deciding who is what, like what you're touching on, like
labeling.
It's the labeling. You're traumatized. You need to do this and this. The truth is that I love this definition of mental health, which is mental illness is defined as affecting your ability to meaningfully participate in your life in a way that aligns with your values.
Okay.
So that keeps the autonomy of what it means to be fulfilled, right? You're defining it instead of someone telling you how you need to be. So
it takes away the comparison. Well, that happened to me too. I have no problem. Why are you having such a difficult time with this? You know, because it's affecting their ability to function in their life.
Right. And another thing you're touching on is the theory, the biopsychosocial theory in psychology, which is that really nice integration of nature versus nurture, right? It's like there's a psychological aspect to it. There's a biological aspect to it. There's a sociological aspect to all of our behavior, which makes it very complex and nuanced and makes people respond in very different ways based on their personality, their genetics, their birth order,
Absolutely.
their gender, their sex, whatever it is.
Every single of the same 5 friends, we'll just say the same 4 friends, we see each other 40 years, every 4 to 6 months. Lisa, obviously, since we were little, we're all firstborn. Now, I mean, obviously, we're actually, I think almost everybody, I even my 700 marriages, I only had 2, but I like to say firstborn. You know what I mean? So I never thought about it, but it's I definitely, and you know, you don't want to label everything, because then the people who are labeling, I feel like it immediately restricts you. You know, even if someone calls me something, or, oh, well, you're that kind of person. Yeah, but I'm also this, and this, and the other thing. And so I don't want to then act as if, because I have been labeled. But those firstborns, man, they're all the freaking same.
I'm so curious to hear some of the characteristics that you've noticed from all your firstborn friends.
Oh, firstborn, leadership qualities, taking care of the rest of the family, even when, like, our parents passed away. And it wasn't because, and it was because I just finished like probate and all that and whatever, because my parents died in the last few years. I handled all of it. It wasn't because I was the firstborn. It was because I was the one to handle it and would handle it. And nothing against my siblings. It was never even considered that they would handle it. You know, I mean, they've been
conditioned to being that.
Definitely more. I'm not conservative, but there is a thing about rules that I like. There's also a thing about rules that I don't like. Probably most like my parents. All the things. All the things. Definitely more optimistic. I think I look at glass half full. All my friends are much more. We laugh all the time. We play. We don't stress too much about little things.
There's a sense of empowerment.
100%. 100%.
I wonder, is there any loneliness in that?
Oh, sure. I think so. I like to be around people, and there's always and I've talked to other firstborns. I personally, I don't mean to get this into, you do this shit. Fuck, I need to stop. But I have very high expectations. I work very hard. I don't want to say I'm a workaholic, because that has a negative connotation. I like to work.
You're getting so much into that same thing about limiting,
right?
The limiting nature of words, and it's such a dilemma of being a human, because it's our only way to communicate, and yet it's inherently limiting.
Yeah, but it's the only way to put things in the categories. Well, let me ask you this. So that's a. Are you married with children? Okay, that's a lot that you deal with during the day. I can't even imagine some of the stories that you hear. How do you manage yourself and go home and then turn on mommy wife brain? And that's a lot about what we talk about in Vitality Vault. Very high functioning, very successful women, and the balance. And I don't mean family life balance, because it's not like a 50-50 ever. It never is going to be, but more of the emotional balance. And I always envision, I think as people, we always, we have our external self that we give to everyone else, and then we have our internal self. And there's a lot of, with women, invisible barriers we put up because we don't want to do too much, or what we might get made fun of, or someone might talk about us, or who do we think we are to have such lofty goals? And then if we do have lofty goals, then we're a bad mother, or we're a bad wife. You know what I'm talking about. I don't have to say it over and over again, right? And that's a lot of what Lisa and I have a book coming out, and we talk about that. We talk about the neuroplasticity and how certain things you can change your brain and those limiting beliefs that we all have. And then also how our brains are just different from men. And maybe, and I would be very stuck when my children were young and I was very tired. Why can't you help me more? Why can't you do this? Why didn't you listen to me? And I know now brains function very differently. And so it's almost funny to me sometimes. I know I can send my partner to the store, and if there are more than 3 things on that list, something's getting fucked up.
This is a huge topic for me that I talk a lot to moms about. There's a couple of things I wanted to respond to. The first is how do I balance working and home life? I don't know if balance is right. It sounds like such a static word, and it feels much more dynamic to me. It's again, the limiting nature of words. It's just like everything's always in the air.
Right.
It's like you never catch it. It's like something is always in the air. Being a working mom is so hard. I think for me personally, the guilt comes up the most for me. For sure. Being away from my kids, doing the daycare stuff. They're in an amazing daycare. I spend like all my money on it, and it's horrible, but they're in a great place and they're happy, and I still feel guilty. The guilt comes up, and I know it would come as a stay-at-home mom too. It just, you can't escape it. So I just, part of being a working mom or a stay-at-home mom is accepting the guilt and just accepting that it's going to be there. It's just
kind of who we are, because
and doing it anyway.
Yes,
doing it anyway,
and understanding that you're going to have that guilt, but your kids learning different things. He's socialized. They're doing a lot of things. I mean, we'd love to bubble wrap them, and never anything bad will happen, and you will never have any struggles, and you'll grow up and be a highly functioning adult and be happy all day long. That's not real. It's just not realistic.
And it's part of your job as a parent to worry if you're doing a good job. So that translates to feeling guilt as a stay-at-home mom or a working mom. Because that's your job, is actually to think about it.
Now, do you worry about because women can be rough on other women. And that bugs me. I mean, it doesn't bug me sometimes. It's annoying. I don't think men pay that much attention. Generally, if you're working and you're busy, they're not thinking, oh, you're a bad mom, or you're not doing this. But women do, even if it's just a little, oh, isn't that nice? You get to go to work every day. You know what I mean? Those voices. I don't know if you experience that. You know what I'm talking about.
Yeah. This is
how do you? Here's this, and this is what we talk about with Hayes and Tremaine. How do you? Those things will happen. There will be those people. People will say things. How do you not let it stop you from that internal self that wants to leave a mark on the world or do the thing that they've always wanted to do? You know what I mean? I mean, we push ourselves off to the side. I'll get to me when I'm done taking care of everybody else.
Mm-hmm. I talk to a lot of moms about that, and this is going to answer part of your question you asked earlier, which is how do I balance everything emotionally? I'm in a very, very privileged position in my profession, specifically in my field of perinatal psychiatry. As a young mother, I benefit so deeply from talking to these moms every day, because I get to see how other moms truly feel. You know?
Right.
And so I'm not in this insta bubble where I feel like I need to be perfect and that everything's going to feel good. I know firsthand what it looks like to be a mom. Like, it's very hard. And I get to hear people talking about it in a way that most moms don't get to hear. And that's one of the reasons that it's so hard for a lot of moms, is because there's not a lot of discussion about this is hard. the mother figure in our society is complicated for a lot of reasons. First of all, like from a psychodynamic perspective, which is like Freudian stuff, right?
Mm-hmm.
A mother is like a very complex figure to everyone because everyone has a mother. So we don't want to ever consider in our unconscious minds, we don't ever want to consider that a mom would feel anything but complete joy and bliss about being a mother.
Mothers aren't even people. Don't you remember
exactly.
being little?
You're touching on the truth
people.
of that. Exactly.
They were moms.
Yes, and it's still prevalent. That's still pushed around in society 100%. And so I don't live that same level, that same intensity of delusion.
Sure.
Because I get to be exposed to true motherhood.
Because you have a tribe here. Like we used to have.
Yes.
Hundreds and hundreds of years ago, and the mom and the aunt and it wasn't I'm alone in a house and I haven't seen people in 6 weeks and I have a baby crying, I'm exhausted. You had a tribe of women. You had and so you have that here. It's fantastic. I wish somehow we could get that back. I know it's not going to happen. Progress brings us wonderful things, and it also takes away things that we didn't realize we really freaking needed. People have their online stuff. That's not a community. I know they call it online communities. I don't consider that a community. That's online shit. You know what I mean? I'm not getting any benefit from you. And a lot of people, and I know I work with a lot of people in their 20s and their 30s. They're almost less social because of it, because they edit and they worry about everything put out there.
And for every comment that says, you know, this is hard, it's hard to be a mom, you're doing great, there's 3 comments saying like, you should be making homemade Play-Doh,
right?
Not eating any gluten, and so on and so on and so on. And so it just, you need somebody in front of you saying like, hey, I see you. This is really hard. This actually fucking sucks. And like, tell somebody with a newborn that, you'll be the first person to tell them that it fucking sucks. Because all they're hearing is, what a blessing. Congratulations. You must be so happy. This is wonderful. And you know what? I was lucky to start working here when I had a newborn, because I was still in it and able to say like, oh my God, this is horrible.
It's horrible.
This is the worst.
It's lonely. It's boring. It's all things. Well, let me ask you this. So how did you get to where you are? What did you always knew what you wanted to be? And if you did, God, I envy you, because, you know.
This is a great story. So I was always a nurse, and I worked in rehabilitation centers. I worked inpatient. So I worked in medical settings, not psych settings. But I started to notice that psychology permeated everything, especially in medicine. And it was just so unabashedly ignored that I found it bizarre. And I started to notice it more and more. You know, for example, there'd be a patient crying about missing their dog at home.
Right.
Or somebody who had, you know, some delusions and needed some psych meds on the floor. And the way that these patients were stigmatized and their emotional needs just tossed aside it seemed bizarre to me, because I was like, this is part of health. Is it not?
Of course, it's a mind-body connection.
Right.
So just because we fixed your legs because you were in a car accident and you're healed enough to go home, bye.
Yeah. Like,
what about the rest of the shit?
This person, let's talk about getting the dog to come visit, or let's talk about like, what are her delusions about and how does that relate to what's happening? You know what I mean? Like, so I started thinking about that more. And so then I finished my undergrad in psychology. I'm going way back. I was nursing more. Then I started to work in psych in an FQHC in the Bronx, which was a really intense job, very busy, high need area. Then I went and got my master's and doctorate at Columbia. Then I finished there. When I was at Columbia, when I got my master's, I had my first baby. When I was getting my doctorate, I was pregnant with my second. We were about to do rotations. which includes like learning to prescribe medications for the first time. So it's a pretty intense rotation. Not the best time to have a baby, but
is there ever a best time to have a baby?
So, I followed in my mom's footsteps. She was a physician and had all of us in her residency, and there's 3 of us. And this was in the early 90s, so it was not a very accommodating environment, to say the least. Anyway, so I was pregnant with my second, and I said I need to talk to my director, who's Dr. Laura Kelly. She works here, as you know.
Yep.
And she was the director of the DNP psych program at Columbia at the time. So I remember getting on Zoom with her and saying, so I'm going to have another baby. And I didn't know she worked here.
Oh, you didn't?
I didn't know that she worked.
And when was this? Recently?
This was when did I have my second? This was in 2022.
Okay, so in the last couple of years.
Yes. And she said, "Oh, well, come work with me." And I was like, "Oh, what an amazing opportunity." Like because she is, to me, she's like a god. I just think she's the coolest. And I was like, "Really?" I didn't even know where she worked. And she's like, "Yeah, I work at a perinatal mood and anxiety disorders center. You can come here and work with me." And I was like, "Awesome." So, and I didn't have maternity leave because I was a doctoral student. You either leave for a year, and I couldn't do that because I'm living on student loans, which are
astronomical.
I couldn't afford it. So I really didn't have a choice. So I had 2 weeks off. I started working here very, very pregnant, seeing patients. And I had a 10-month-old at home at the time.
And is your baby in daycare or?
Yes, she's almost 2 now.
Okay.
My second one, but I started here, had the baby, and then 2 weeks later started seeing patients again here. And Lisa held my newborn.
Oh,
Dr. Kelly held my newborn. I would see patients and then come back out and feed her.
But your baby was here, so
yes.
so traditionally it's either you stay at home, or you go to work.
Mm-hmm.
Either way, it sucks because going to work is nice. Going to work is you're using your brain. You're feeling like you're being productive. You know what I mean? Not that you're not productive. You're taking care of a kid, but we all have different needs. But taking your baby and having help at work, that sounds like a freaking dream.
It's amazing.
Well, I mean, can't every business do that?
I mean, I remember thinking like these
happy
people
mother,
don't just talk
happy
the talk.
baby,
like they walk the walk. Like they are actively doing this stuff for me. I was amazed. I mean, it's still amazing to me, and now I work here, of course. How could I not?
Right. That's fantastic. Yeah. Oh my gosh, if every organization could give the option. It requires a leader like Lisa, and Lisa she's fearless and ruthless about things that are important. And she will she will say this is bullshit. Yeah. Or she'll say, she's also very innovative. She'll say like, okay, people say we've never done this before. What do we do? Say, we'll figure it out. Let's try something new. And they go, oh, something new. I don't know if that's in policy. And she said, well, let's figure it out. So it takes someone pushing. I think we've never done this before is just kind of been pulled along over the generations until even the last few years. I have clients with my marketing company. And they're like, well, that's not the way it's done. I'm like, well, so?
Exactly.
You know what I mean?
Yeah.
So we do it a different way because life changes, the world changes, requirements, everything freaking changes every day. Why do we hold on to these old ways of doing things when people...
Well, that's a good question.
When it's not working.
Who does it benefit? It begs the question, who does it benefit?
We know who it benefits.
Right.
And I don't want to get into that, but we know.
And this comes up a lot for the patients. I say that they have to advocate for themselves and things like what it looks like for them to return to work after they have their first baby. And the same response. Well, we've never done this before. And it requires a mother who's freshly postpartum.
Because we didn't have... we weren't able to make the decisions on how it was done.
Right.
Nobody considered half the population and maybe their needs.
Exactly. And so you have to advocate for yourself, unfortunately, in a lot of situations. This reminds me of my mom when she was a resident. I don't remember what they call it. I think they're attending. She told her attending that she was pregnant. And he said to her, "You can't be pregnant." She's like, "Well,
that's how the species continues."
And she really inspired me a lot of ways, but I didn't need to use the inspiration because I had Lisa. But she said, "Well, let's figure it out. Let's figure out a way to do this because I'm doing it. What are you going to do? Kick me out? Like, no." So.
And sometimes it's as simple as not accepting.
Exactly.
"Oh, I'm sorry, we can't do it that way." Well, you know what? We're going to have to try.
Exactly. And it's so hard to do that because there's a lot of fear, and what is the fear there? That's what you have to really ask yourself. Like, what is the worst case scenario? And for some people, the truth, like it really can be, maybe the person could fire you.
Right.
That's true. That's a
real fear, but generally our fears are so much bigger than actually what happens.
That's true.
And also we as women when you speak up, I'm called bossy and bitchy probably once or twice a week. I do not fucking care. However, I'm older. But if you're 20 and you're 30 and don't be bossy, don't be bitchy. And again, it's 2024. It is not 19. I'm going to even say 1990 or 2000 because it has not been that long. I think it's that fear of not being liked, not being part of the community. Because, we're tribal people. We're community people. We want to be part of the community. We want to be in. And if we make the waves, and we've been told for thousands of years not to, we may be then out. None of it's going to happen, but subconsciously I think that we function that way. I think that's changing. I know that's changing.
You're absolutely right. I want you to edit out
the
part where I said fired. You'll get fired, or the fear may be there because your point is more important, and I want that to be highlighted, that the fear is usually not going to come to fruition.
Right.
And in a lot of situations, it's more work for the person to have to do that than just to accommodate your ideas.
Do you know how expensive it is to fire someone and then interview and hire someone else?
So you're
it's
in
a lot of money.
Position to bargain. Yeah. I mean, to debate, and leverage that.
Mm-hmm. Mm-hmm. Well, I think things are changing. I think women are, and we talked about this, and God, we could talk about this forever. I think, and what we're hoping to do is talk about the approach instead of being like, approaching it from a victim's, poor me, we don't get the chances, we don't get the opportunities, nobody helps us, we're very tired, and those things. Say, okay, instead of that, it's your fault. Okay, well, I'm in charge, and I have to advocate for myself, and so this is what I want. And if you're, it's the external situation that I'm in, whether it's home or whether family, in-laws, whatever it is, instead of getting so angry at those people who have their own lives and their own triggers and their own experiences, everything else that they're going through, advocate for yourself. What can I do to change it that works for me?
That is very wise, because if you come from a place of victim mindset, it is inherently exhausting because you're just reminding yourself how exhausted you are.
And you're never going to get anywhere. You're not going to change other people.
There's energy in that.
Yeah. Yeah. I think that's a good place to end.
All right, great.
This was fantastic.
One more thing I wanted to say.
Go for it. Do it all day long.
Holding on to it. It's kind of controversial, but I have to talk about it.
Love controversial.
You mentioned something earlier about sending your husband out
to get three things.
Yes. My generation, I'm speaking for a whole generation, which is a fallacy, but I can speak for myself at least and know that there are many in my circle in my generation that are not fucking taking that shit from our husbands anymore. And a hetero relationship, like, for example, okay, this goes into like mental load stuff. Are you familiar with mental load? Okay.
Yep.
And I can give you some examples from my own marriage, but men can do this shit. Like, a man can go to the store with the list and get the shit.
Sure.
Like, these men are attorneys and engineers.
But they can. No, they can do those things.
You can do it.
I pick and choose my battles for my own sake, not because they can't do it or he doesn't want to do it, whatever. Men can do things. They can do a lot of things, but can they do more than one thing at a time? They, according to, oh God, I wish I had the resources in front of me.
To.
But I don't know if that's how their brain works. And there's a lot of studies, and we can talk more about this. And again, you're the expert, not fucking me. But yeah, they can do it, but they are not. We have different brains in them. We can be mad at them. They don't have our brains. They can be mad at us because they don't understand us. Or we can say, okay, what kind of biology are we dealing with here? And what is the neuroscience portion of it? And can we, instead of being pissed off, it's not going the way we want, say, okay, it's like dealing with apples and oranges.
I hear you. And that comes up for a lot of people. And I've experienced it myself too, where it's like, okay, is it worth even putting the effort into trying to change this, or should I just accept it because that's easier for me in the long run? When I've thought about that, at least in my own experience, the answer is usually it is worth the effort up front, because I don't want to deal with having to pick up the slack that my husband is perfully capable of.
Oh, 100%. Oh, and I'm not saying to let them off the hook. They don't have to do anything. I'm saying almost like, Lisa's going to be pissed off at me for this one. Almost like a child. Say, this is what I need you to do today. And I'm not saying they're children. This is what I need you to do today. And providing it in a structure that makes sense for the way they function as men.
Yeah, I think you are touching on something important, which is, and I work with patients on this a lot, which is specifying needs and communicating them in a way that's clear. Because as women do communicate differently, I will support that neuroscience piece, right? Mm-hmm. I do think the biological differences, especially in terms of behavior, are overemphasized between men and women. And I think that ends up oppressing a lot of women. So when that comes up, I like to be very careful about where it goes.
I love what you just said. You said you look at it. We have a biological portion. We have a neuroscience. There's a lot of portions of it. Yes, it is complex.
Of course.
So the answer isn't one answer. The answer is many answers.
Right. And this also comes down to, some issues with sexism in our society, which is overgeneralizing things about boys and girls and men. Mm-hmm. And women. Some men are like that. Some women are like that. Again, it's very complex and nuanced, which is why we have to think very, very hard about the way we talk about some of these issues, because it can end up causing real harm. And the intent may be good, but the impact can be very negative. So,
well, we're always trying to do better.
Right.
All right.
It requires a lot of thought. And again, like language, inherently limiting. So it requires a lot of discussion and discourse, which is what you do. I think it's really cool.
Yeah. What we're doing now. And yeah. I appreciate so much. This was fascinating. I could talk to you forever. I usually have Maddie here, and usually I refer to Maddie because she's 26 years old and she'll like chime in on things, and she's fantastic. So, and then she keeps me on track. So I have no idea how long we've been talking about. But I will also make sure she edits that up. But thank you, Jordan. I'm not going to say your name right again, but I love your outfit.
Thank you.
And your hair too.
Thank you.
Thank you so much. All right.